So, should a patient be referred to hospice solely for psychosocial needs? Okay, so this could be it could be a yes, it could be a no and a yes, and depending on the situation, right? For example, we'll start with a no. So the patient who has had no decline, right, per Medicare guidelines, depending on their diagnosis, um, they've had no weight loss, no increased needs in oxygen, hospitalizations, wounds, decrease in mobility, whatever it is. They've had nothing documented of any sort of decline. But they are one of those patients that could be lonely, just need more visits, right? Because in the long-term care space, for example, the reality of it is there's just not enough staff to the amount of residents there are. Okay, so we'll go with the no first, right? That situation would be no, right? But then you could be a yes on a patient who has clearly documented decline, right? Um, and they need extra support. They might not need, the way their decline is going, maybe they don't need a ton of like medication adjustments, right? Could be that patient that you can just stop all their routine meds and that will make them comfortable. um they're less verbal, they're less engaged, right? But that, yes, right, could benefit from that extra support, because say in that situation that patient doesn't have family, right? They're comfortable as they decline. And when you work in long-term care, you learn how to manage, medications and stuff like that at the end of life. So, a long term care provider could manage, their medical needs as they decline. But like I said, what about that patient who doesn't have family, right? And they could benefit from those extra visits that a lot of people you will hear in hospice, that extra layer of support, right? They could, a nurse coming out twice a week or whatnot, a CNA, a chaplain, volunteers, you know what I mean? Because they don't have that family support. Their medical team can handle the medical, but then there's still more of the picture as somebody is dying. So I wanted to just share that, because I've experienced questions recently, regarding both those scenarios. And so, yeah, just wanted to share that.